Hello everybody, and welcome to this week's Facebook Live from Floyd Medical Center as we continue to explore our response to the COVID-19 pandemic. I'm Dan Bevels from Floyd's Public Relations Department, and we're glad to use this platform to come to you every week and talk to you a little bit about what's going on at Floyd and reassure you that we are doing everything to keep you safe and continue to provide the excellent care we're known for. Today I'm joined by our Interim Chief Medical Officer, Dr. Ken Jones, and Dr. Jones and I are going to talk a little bit about where we are today and a little bit about what's to come in the weeks ahead at Floyd Medical Center. Dr. Jones, thanks for being with us.
Thank you.
Let's start by addressing one of the things that I think is on everyone's minds right now, and that's the governor's decision to begin reopening the state and trying to reopen the economy. And we certainly don't want to wade into the politics of that decision at all, but I would like to know from you what recommendations you would have for folks who are thinking about getting out, particularly those that might have compromised immune systems.
Well, the governor has gradually going to open up our economy, and everybody still needs to remember that this virus is still out there, and they need to protect themselves and continue doing the things that we've talked about, which is washing your hands a lot, not touching your face with your hands, and to wear your mask when you're out in public, and then keep that 6 foot minimum distance from other people. And also, he's talked about the medical fragile. He's recommending that they really shelter in place as much as possible until May 13th. And we all think that's a wise choice too.
One of the important things to say is, we talk about the peak and the belief now that Georgia may have peaked last week and ours is in the very near future, but the peak doesn't mean that it goes away. We're still testing patients, we're still seeing positives, so I would think we would certainly recommend every level of caution that we took in the early days of this.
I agree 100%. Just because we're opening up the economy some, it does not mean you do not need to protect yourself. And especially the medical fragile, those are the ones that we really worry about because they can't fight off this virus as well as a young, healthy person can.
Now, one of the safe places to come, if you need to, is our facility. We want to reassure folks of that too. We've heard stories about folks being nervous about coming to the ER or to an urgent care location, but you're safer here than you are in a lot of places, right?
I agree 100%. We're screening all our employees, all the nurses, all the providers are getting their temperatures checked. They're checked for symptoms when they come to work, and during work, if they develop any symptoms, then they're quickly asked to go home and seek health care. We're in the ER, we're putting masks on everybody that shows up. If you come in with a turned ankle, you're getting a mask to protect yourself from the other patients in the ER. I venture to say it's much safer to come to the hospital than it is to go to the grocery store.
And we have those procedures in place even at our urgent care.
That's correct.
Can you talk a bit about that, about how we might handle a patient that's in some type of respiratory distress as opposed to someone that's in because they've got a scratch or a nick or a cut?
If you come to the ER or to the urgent cares with respiratory symptoms, you're going to be handled in a different manner than the ones that are not that way. Both will be protected with a mask, but you'll be in the urgent care centers. A lot of those are being taken into a side entrance into a room that's especially equipped for them, and in the ER you're put in special rooms that are specially equipped to handle patients with respiratory symptoms.
Now, one of the things we're offering in our primary care network, and the timing couldn't have been better, is the telemedicine program. We're beginning to roll that out, and several of our doctors are using it very successfully right now. Can you talk a bit about how that might work and maybe what conditions particularly work well in that setting?
It works real well for patients that just need a routine follow-up and are doing stable on their medications. It's just time for refills. They can call in and have the visit and not have to worry about leaving their house. It's a little different to try to treat acute care symptoms. It can help decide where is the best place for the patient to go if they need further health care. But if you've turned your ankle, it's not a good place to try to figure that out.
And we just encourage folks, if you're curious as to whether you might be eligible for a telemedicine program, it's as easy as calling the office, right?
That's correct. That is correct.
Okay. Let's talk a little bit about, we talked about the state reopening the economy a little bit. One of the things that we are beginning to reopen here at Floyd to some degree is our surgery procedures. We're beginning to bring folks back in that maybe we would have postponed earlier in this cycle. Can you talk a little bit about what that's going to look like at Floyd and what may now be available?
Yes. And when we had the initial outbreak of the COVID and we had a reduced supply of personal protective equipment, we ranched back our surgeries to where we were only doing emergency type surgeries. And now that we've built up a good PPE supply and we've got a better grasp on what we think is going on in the community, we've started opening up our operating rooms to do what we call urgent care, urgent type cases, which are those where patients are actually having symptoms, but it needs to be surgically fixed. But we weren't doing those initially because we just couldn't have enough PPE and protective equipment. But now we know that those cases need to be addressed so that people don't have long-term problems or continue to be in a lot of pain.
And those folks that are coming in for those surgery procedures are, again, like we were saying before, we want to stress that those are very safe and we're taking proper procedures. Can you speak to that?
Same type procedure goes for the operating room people and for the patient coming in for surgery. They will be protected better than going to the grocery store.
You mentioned PPE, and we are in good shape, right?
Yes. David Early's team with materials management has done an excellent job in procuring. We have really a great supply.
We've in previous weeks we've talked about how grateful we are for the support from folks and how they have certainly reached out and offered encouragement and have brought food and have made signs. What would you say to our folks from your position as one of our leaders here at Floyd? What would you say to the folks about the work they're doing?
The nursing staff, everybody in the hospital has just done a great job working through this tough situation. A lot of them are working in jobs they're not used to working in, and that's been wonderful. And then the support from the community, bringing in meals, making masks, just the words of support. A lot of cards and signs have been brought to the hospital and placed on our parking deck. We've had some signs that have been approved and placed there, and it's just very uplifting for the staff, and I'm just feel blessed to be part of this team. Mm-hmm.
Dr. Jones, thanks for spending some time.
Glad to be here.
I know you'd much rather be working with a patient than stand in front of a camera. So.
Well, we need to get the message out that it's safe to come here and to come if you need help.
We appreciate it, absolutely. Thanks for joining us today. And thank you for joining us also. We are grateful that you're spending some time with us, and we are pleased to be able to bring you the latest information about what we're doing here at Floyd to address the COVID-19 pandemic. We're going to do this every Wednesday afternoon through the month of May in an effort to keep you informed, so we encourage you to join us each week. And just to reiterate what Dr. Jones said, we encourage you to continue to trust Floyd with your care. If you are in need of medical care, don't stay home, with fear that you might not be safe. We want to encourage you that we are taking every precaution, whether you're coming to our emergency room, to one of our primary urgent care locations, or one of our outpatient facilities. We will do everything within our power to ensure that you are just as safe today as you were before this started. So we encourage you to not take a chance, to come on in, and we'll take care of you. Until next Wednesday, thanks so much for joining us. We'll talk to you again real soon.